Sawadika, thank you for joining us for the NBT World Brief. You're here with me, Shanita Sidakit Krathon. As the Thai-Cambodian border conflict enters its 13th day, the Thai army has released what's it called clear evidence that Cambodian forces used ancient temples as military bases and involved civilians in combat. Actions, it said, violate international law. The Second Army region today released video clips and photographs that said prove serious violations of the Geneva Conventions and international humanitarian law by Cambodian forces. According to the army, the evidence shows the use of ancient temples as military bases, the involvement of civilians in combat-related activities, and the placement of civilians inside active combat zones without separation from military personnel. The army says civilians were allegedly used to support military operations at ancient sites. Particular concern was raised over activity near the historic Tao Kwai Temple. Meanwhile, Royal Thai Army spokesperson Major General Winthai Suwari said Cambodian forces have deliberately targeted civilian areas including homes and farmland, particularly through their use of BM-21 rocket systems. Authorities report that 23 civilians have been killed, with one person dead after the rocket directly hit a residential home, while 22 others died from indirect impacts linked to the violence. 6 civilians were injured and more than 400,000 people have been affected overall. 20 hospitals and 201 health centers have also been impacted, including a direct strike on Phnom Dong Rak Hospital. Schools across several border areas have been forced to suspend classes, disrupting education for children and youth. The army said civilians should never be targets of military action and called on Cambodia to immediately stop violence against innocent people and comply fully with international and humanitarian law. The Ministry of Public Health has deployed mobile prenatal clinics to temporary shelters in Ubon Ratchathani in an attempt to help protect pregnant women affected by border tensions. Public Health Minister Patana Prompat said the ministry is deeply concerned about the health of people displaced by the border tension and has strengthened medical support in affected areas. After visiting an evacuation center in Sa Kaeo province and meeting frontline health workers, the minister said referral systems for patients and the injured have been organized to ensure fast and efficient care. Medical personnel and resources have also been on standby to respond to emergencies at any time. The health minister noted that the current medical response plan remains at level 1, while 12 hospitals located in high-risk red zone have been temporarily closed for safety reasons. Meanwhile, Dr. Amporn Benjapon Pitak, Director General of the Department of Health, said the Regional Health Center in CONDEMNS has been assigned to work alongside Regional Health Center in Ubon Ratchathani to deploy medical teams and operate mobile prenatal clinics directly at temporary shelters. These mobile units allow pregnant women to receive antenatal checkups and other health services on site. The program follows international risk screening standards and includes a 24-hour emergency referral plan for patients in need. The initiative focuses on preventive care for mothers and children during a period of continued concern and uncertainty. Officials say that 5 pregnant women have already received services through the mobile clinics, with more expected in the coming days. And that wraps up this edition of NBT World Brief. You can stay updated with the latest developments right here on NBT and NBT World. And for more stories, simply scan the QR code on your screen to access full coverage across all media platforms. Until next time, I'm Shanita Sidakit Krathon. Sawasdee ka.